in. Again, I can cite my personal example here. I have an interest in respiratory medicine. And in that, within respiratory medicine, I had an interest in asthma, but I couldn't take that up in first year. So I went into sleep disorders. Now, within sleep disorders, I chose sleep apnea because it's something that often gets neglected. And it often doesn't present itself until a person's midlife. So I decided to work on sleep apnea, assessing the risk in young adults, so that they could be aware at a younger age itself as to what they are likely to face later in life and how they could take corrective measures to ensure they don't suffer from it in the future. Now, this is often the state that lands up of most students who want to take up a research and who start. Now, as Sir rightly pointed out, we have that question, why should we do research? Now, many of us who have presented here might have ambitions of going abroad for post-graduation, or maybe we took it up because of some pressure from our college, or maybe we just took it up because our seniors did it or our friends did it and we want to compete with them. But the main question we should ask is, why to do it is not because somebody else did it. We should take up research because we have an interest of doing it, and we have an interest of doing something to the greater good of society in itself. Now, as Sir rightly pointed out earlier, do we have somebody who can actually guide me through it? Now, a guide need not be only from the college. It could be a faculty, it could be a postgraduate student, it could be your seniors, or it could be anybody at home, anybody in society as a greater whole, because there isn't really any barrier to learning. We can learn from anybody and everybody, and the only thing that stops us from learning would be maybe our ego and our own cap, what we cite on ourselves. If we decide that we want to keep learning about something, we can and we will be. Now, I think the most important thing would be, why do all of it? Because I'm sure most of us at the end of the day, we want to just see that we come out with many degrees, get a good job, have a good salary, and lead a comfortable life. But a few of us here and there, we want to do something good to society, we want to make a difference to people's lives. But somewhere in all this, we all ask ourselves a simple question, what would we get in return? Now, at student level, ICMR, the 10,000 rupees, what they give might seem like a large amount to us. And as we go higher, the grants and the rewards also keep multiplying. But sometimes I think we should draw a line that research shouldn't become money-oriented or marks-oriented. Now, let's assume for a minute that research does become a part of undergraduate curriculum. There, if it is a part of the curriculum, we'll end up being assessed with it. And once we are assessed with it, it's likely to have marks. And once that element of marks does come into picture, we won't really see it in the way we see it right now. It will end up becoming another sophisticated way of having an exam. So if we do implement it, how we implement it would be a big question. So before concluding, I'd just like to say, if nobody researched about the new drugs or keeps working on these, there wouldn't be any evolution in treatment. So we'd be treating diseases the same way we did 100 years ago. And before becoming good doctors, we need to have good drugs to treat patients with. And if you are not interested in the field of medicine and you want to go to a surgical field, even there, the procedures what are conducted on a day-to-day basis are done only after rigorous research, even there, as to which is most effective, which is likely to cause least trauma to a patient, which is likely to have the fastest recovery, which is likely to have the best long-term. So whichever field of medicine you take, the treatment lines have come only as a result of the development of research. So on that note, I'd like to open the forum for discussion, and you are all free to ask any questions you feel like. Thank you.